Hi there, my name is Blayne Rush, and I'm with Ambulatory Alliances. We're a full-service healthcare investment banking and M&A brokerage firm that has significant experience in advising physician practice owners and owner-operators of outpatient centers. Today I want to give you an update on the physician practice mergers and acquisitions market. You know, physician practice and healthcare M&A has been on a tear over the last few years as the savings tied to the economies of scale become even more important as margins tighten. Hospital-based health systems, outpatient integrated networks, consolidators, and private equity continue to aggregate ambulatory centers, physician practices, and other clinics and service vendors. Medical practice acquisition, aggregation, and integration are becoming a commonplace in healthcare. Independent physicians, faced with regulatory changes, find advantages in joining a larger group, many who are backed by private equity money or becoming employed by the hospitals, and we're seeing larger groups become platforms for private equity groups. According to the 2016 Healthcare Services Acquisition Report, provider consolidation has grown 14% on average each of the last 7 years, and most agree that that's not likely to stop anytime soon. Capital funds push the total disclosed deal value for healthcare private equity to $36.4 billion in 2016, and that's the highest level that we've seen since 2007. As already noted, the physician group sector has seen a strong interest from outside companies. This surge in consolidation is partially driven by provider responses to both the challenges and opportunities created by the national and state healthcare reform. You know, for example, a multi-site provider, be it GI, ophthalmology, interventional pain management, orthopedics, etc., can look for an investor or strategic partner that will allow the group to grow through opening new clinics, adding new services, as well as buying other practices and ancillaries. A small group could also sell out, taking advantage of the historically high purchase price multiples and the opportunities that being part of a larger network offer, while mitigating the challenges that all providers are facing. It's becoming more expensive to grow a practice, and new technologies are as expensive as ever. You know, as an example, in the physician services segment, Audex, which is a private equity, they recapitalized Gastro Health, which is a South Florida-based GI physician practice management firm, which allows the practice to grow by adding new clinic locations and buying up their competitors. Another is Varsity Healthcare Partners, a healthcare services-focused private equity investment firm. They acquired Katz & Eye Group, which is a large ophthalmology and optometrician services practices. Through this partnership, the two entities, they formed a new entity, Eye Care Services Partners Holding, LLC, with the goal of consolidating successful vision care services practices and affiliated surgery centers. Wad Capital, Minnesota Eye Consultants created United Vision Partners with the goal of building a stronger integrated provider group in the Twin Cities area, and also expanding in 3 or 4 more markets in the near future. There's other examples of these investments that are creating outpatient networks that are aggregating primary care, urgent care, and these surgical specialties, along with labs, pharmacies, surgery centers, diagnostic centers, etc., under one umbrella. With many buyers chasing a limited number of choice targets, valuations continue to rise. Healthcare deal teams at traditional PE buyout firms face heated competition for deals as new categories of players enter into the fray. Physical therapy providers have also seen some growth. Advent acquired a majority stake in ATI Physical Therapy. BDT Capital Partners invested in Athletico Physical Therapy, and THL acquired Professional Physical Therapy from Great Point Partners, which is a private equity group. Dermatology is another active area. In addition to the advanced dermatology deal, GTCR invested in River Chase Dermatology, and Varsity Healthcare Partners sold its majority stake in Forefront Dermatologies into Omar's private equity. Size does matter, especially as it gets more difficult to survive as an independent practitioner. While it can be done, there's strength in numbers, which helps the physicians to be able to withstand the ups and downs of reimbursement changes and to subsequently enjoy a better quality of life. There's different models that fit different needs. Selling means anything from selling a small percentage to selling 100% of your business. If you have any questions about the process or the opportunities, please do give us a call. Thank you for your time today. Have a good